Hi, this is Dr. Bartley Kerr, CEO of National Rejuvenation. So I want to talk today a little bit about what we call the 50-50 rule. And I think it's a nice, in most places in medicine, it's a good place to start with diagnosing and seeing how your patients feel as well as the results on a blood test. Too many times in a physician's office, we rely solely on what a blood test says and the range of those blood tests. That's one component of how to diagnose a hormonal deficiency. The other is going to be symptoms. How are you feeling? And the reason why is there's these things called receptors on a cell. And a receptor is something that can accept or deny a hormone. Just like the Tetris game, when they had different shaped blocks coming down and would fit in another one. Same thing here with receptors and hormones. And hormones are trying to get into the receptor, but we don't know if you have a lot of receptors and don't need as much hormone as the next person, or you're loaded with receptors and a little bit goes a long way, or they're damaged or injured, or there's something genetic wrong with you that we have to alter those receptors in some manner to accept the hormone. So when we look at a patient, it's very valuable to see the blood work. I don't want to say it's not, because it's very valuable to see the blood work, and that's step one. But step two, the other 50% is going to be, hey, how are you feeling? Because if you're not feeling any better, if your blood profiles aren't changing and you're not looking any different, then the stuff isn't working. It's very easy to manipulate those numbers based on how you feel in concurrent with the blood test as well. So we get a better picture on you and how you feel. We have no way currently of testing the receptors, but when we do, we'll even be more exact with this. But that's one of the reasons why at NRC and with Rejuvenation Medicine, we get the results that we do.